So welcome. We're on a tight number of minutes here, so we'll get going. Quick introductions. I'm Chris Steele-Snyder. I lead EY's Health and Human Services Markets practice. We go to market in Medicaid, Human Services, and Public Health. And we're going to spend some time talking about not only the challenges that we're seeing in the state health and human services space and things that we're solving with them, but also to give you all some ideas on how we're using ServiceNow to solve some of those problems and why we think it's a pretty compelling tool to address the challenges that state agencies are facing today.
Gotcha.
My partner Darius here.
Darius Adkins. I lead Health and Human Services mission area for ServiceNow, formerly State of Tennessee Technology Director for SNAP TANF, and I also led the modernization effort for the Department of Human Services for Tennessee for 9 years. So very well acquainted in what it's like to be in state and local government and deal with our federal partners.
Why don't you give a sense of the ServiceNow and EY alliance?
So we've got a great alliance, right? I think ServiceNow is one of those platforms that EY picked up very early and has continued to go to market with our platform across over 5,000 engagements. So I think it shows that they are well invested in our ServiceNow platform, global elite partners. And their SAT score is 4.4 out of 5. I mean, come on, guys. You can't, almost perfect, not quite, but nobody's perfect, right? So I'm very happy and excited. I get to work with Chris often and his team.
And we're also a ServiceNow user. So like what we heard earlier today, we're not only using the tool to help how we run, but we're helping our clients to use it as well. And I don't know where everybody's from. This is more federally focused, but just for those of you who may not know, there's some challenges going on in state health and human services that I thought I'd just raise to your attention. You're not going to find them strikingly different, but I think it's worth just level setting. There are systems in place in state health and human service agencies that are 40 plus years older. The MMIS systems, many of the eligibility systems, many of the child support, child welfare systems are legacy programs that have just been patched and prodded along over the years. And states have really been challenged on how to modernize and how to move forward. AI remains a very scary thing. There was there's an article just written about an agency that was using AI to make health determinations and misread a file, misread a CAT scan. And the patient was about to be put on a series of on drugs that would have really caused some damage. So when it comes to things like child welfare or veteran suicide or homelessness, or a lot of the use cases that we talk about, how and when to use AI is an evolving thing. And we'll talk a little bit more about how we are putting it in place. You hear a lot about human-centered design. Absent thinking about that as a lens through which you build these things, you may just have a more modern program that doesn't address the challenges that people face when they go through the process. And so again, being able to use a program like ServiceNow to help us engage a human-centered design is really, really important when it comes to human services and Medicaid. Again, not surprisingly, data integrity, almost 100% of the fraud that's out there is about duplicate files, duplicate names, pretend names, so on and so forth. And then just the technology workforce. If you're still a COBOL programmer, you're in pretty good shape these days, because there are systems that require that kind of tool set, and there just aren't many around. And so helping agencies to think about how to modernize their workforce to align with the kinds of tools and techniques that we're bringing on is really important. And this is a small group, and we can't really see very well with these lights. So if you have a question or you want to stop, just please raise your hand. So this is just, again, an example in the health and human services space about taking a broader view of modernization and modularization. And so the challenge is, and we've got a client that called it, I guess, made it sound like an iOS system. If you think about the Apple operating system, how do you design a view that will allow you to hang all the requisite apps that will then, in fact, talk to each other, but eliminate duplication? So this is a view that we share with state agencies about how to think in a more enterprise level view of the challenges and the technologies that need to be in place in order to be efficient. I assume you're having similar conversations.
Absolutely.
With your folks.
I'm looking at this slide and I'm going, man, if I only had this slide 9 years ago, how fast could I have gotten to where our Tennessee is today? Because it took us 9 years to get there, start to finish. Technology, I think 9 years. Like the kids come out using iPads at like 2. So what are they gonna, at 9 years? What is it gonna have? What are they gonna have? Right. So our constituents are the same across the states. Everybody's using Amazon for delivery. Right. They're online and they're receiving. They get updates from every place else except for the government. Right. On their phones immediately. And so how do you modularize, wow, tongue twister, and modernize all of these systems to be, to keep up with the times? Because the expectation is, I want to do it fast. I want to do it when I have the opportunity to do it. And then I want to get my results almost immediately.
Right. One of the things that happened during COVID, ironically, was a realization that people who are eligible for state health benefits are more often than not eligible for all state benefits.
Absolutely.
What we also found was while only about 65% of the population had access to computers, 99% had access to phones, and were very comfortable using mobility apps to apply for, receive benefits, communicate with, and secure times with doctors, or to arrange transportation and such. And so we had to pivot when we thought about the enterprise view for the state health benefits plans. How do we make sure that those users are considered as we develop these tools and techniques? How do we make sure that, and increasingly, how do you ensure that people, and we'll talk about the use case, can apply for benefits one time and understand what their eligibility is across all the state programs? So increasingly, you're going to see, at least in our space, I assume, and can only imagine that in the federal space, there's going to be similar type views about how to both modernize and modularize. For the last 35 years, certainly as long as I've been in the space, there was only a handful of vendors who had these large Medicaid systems. What the good part was that 40 years later, they're still operable to a degree. It made it through electronic claims. It made it through Y2K. It made it through the move to, smaller compute power. But they're still the same old systems. And it has forced those agencies often to have teams of 12, 24 people hard coding programs for updates. We had a client just the other day that wanted to add a field. It was $250,000 in almost a month and a half to just add a field to one of these systems. So when CMS, I don't say forced, but encouraged and created an environment where states had to start thinking about their system in more component pieces, a couple things happened. The good news was they were able to have more competition, better innovation, and they got to control their price points a bit. The downside was they went from one contract to administer to sometimes a half dozen or more to administer with the same number of people in their agencies. So that's why this view and what ServiceNow is talking about, we get really excited about this idea of AI agents, right, that can do a lot of that stuff. But those are the challenges. Those are the give and takes, adoption and integration with these systems.
I think one of the other great benefits of going with the ServiceNow platform is there is no need to rip and replace everything at one time. I don't know, anybody in here from state and local government? Anybody mostly federal government in the room? Okay. So at a state and local level, when you go through one of these projects formally, you had to rip and replace everything at the same time.
Big bang.
Big bang, and big bang we found does not work. At least not successfully anyway. For me, being able to implement ServiceNow meant that I could keep my mainframe system that went in when I was 15 years old. I'm now 55. So you do the math. So my mainframe system was 15 years younger than me, and I was going to rip and replace. Scared the bejeebies out of me. So I'm like, no, let's leave that going until we figure out what we're doing. So we were able to keep that in place and then, take module by module and implement. Terrific benefit for any state getting ready to modernize a 30-plus-year-old system. So Medicaid, you guys, EY has they've been a phenomenal partner as well, working in Medicaid. One of the opportunities we saw here is this was new territory, right? CMS was advocating for going modular, and so Arizona said, let's try it, and they did 10 modules in 14 months.
Yeah.
Almost 15, but 14 and a half-ish months. Unheard of, right? When you start thinking about replacing some major components, appeals and hearings, that federal department, anybody in appeals and hearings deal with that? Yeah. So you already know the challenge that we have in timeliness, being able to adjudicate that appeal in a timely fashion and come up with an outcome that we can respond to the appellant, right? So that's always a challenge because snail mail is pretty difficult, and CMS and every other agency with a 3-letter acronym has their own rules about how you have to notify people. So we were finding, and many of us that deal in this area find that we have a challenge with notifications, with even the adjudication of the claim. At the end of the day, we still have to notify everyone, and that becomes a significant error because people move. You think about it, it's a transient population oftentimes that we serve. So people move, people change their phone numbers, and we're responsible as the agency for notifying those people. So Arizona took a very different approach than any other state. And, you can see here by the quote at the bottom, the only way that we're going to be able to modernize these big care systems was to free up time that people spent doing things that could be automated. So it took a lot of the automation process of the 12 other jobs that I have so I can focus on the one job that I'm really supposed to be doing.
Yeah. And I think key to this too is understanding that this was not just development, it was It was the planning, the development, the communications, the testing, the move into production, the socializing and training with staff. So where this benefits in our market is, first of all, the team and the leader, Anthony, in Arizona, was willing to step out and do something that had really not been done at this scale or in these kind of programs. So that's pretty compelling. Second, to their credit, CMS was really supportive. Hopefully nobody's from CMS, but that's not always the case, right? So they were very supportive. And that kind of speed, when you think about that same scope, absent this approach, is a 5-year exercise.
Yeah.
Just full stop. 5 years, during which time administrations change, federal regulations change, state regulations change, technology moves forward. You just can't go that fast. So we call this out, and the hope is that y'all can think about how this applies to what you're doing or your agencies or who you're talking to as an example. So moving on, with the success of the Arizona program, which is still going on, and our relationship with ServiceNow, we started talking about a use case that, frankly, our industry had not touched on for 20 plus years. The market has been owned by a couple, 2 or 3 vendors who all basically share some variable of the same technology system. And it's highly representative of everything that we're all challenged with, which is hard-coded, no rules engine, very expensive to maintain. Changes are faster in policy and legislation than there are in the actual application. No ability to do what-if scenarios, can't get notices out on time. And you're talking about something as intrinsic to people's health as eligibility for benefits.
Yeah.
Right? So we sat down, and it's not a small thing to kind of crawl into a new market like this, and said, what would have to be true for us to think about reimagining both enrollment and eligibility determination from a technology platform. In the process, looked at a number of different platforms. I've been in the space for a long, long time, and would not have ventured in, and certainly would not have taken EY, the firm, into that place, given just the risk and the brand risk and just the difficulties. We met up with the ServiceNow people, and it completely changed our minds. And so, again, in case you don't know, eligibility determination is just that. It is the applying for, providing the information necessary for agencies, programs to determine eligibility and to begin the benefits administration. Integrated eligibility is exactly what you would think it is. People are eligible for discrete programs within a state environment. So it could be SNAP and TANF benefits, it could be Medicaid, it could be child care, it could be child support. The problem is that all those systems are standalone. And so the idea of integrated eligibility is, how do you determine eligibility with a single view that runs concurrent throughout all of the systems and looks at the whole person, right, from a benefit standpoint. That was the first, that was the back. So 20 plus years of being able to do that to a large degree with old antiquated systems. So if we were to do it again, what would that look like? You see the second group here is all the different programs, but really, again, what would have to be true? I talked about human-centered design.
Yep.
Again, people are real good with apps. They're not great when it comes to going online and filling out what had been pages and pages and pages of applications, or uploading forms, or giving access to certain systems or records. So when I talk about what had to be true, we had to apply this human-centered design so that the screens flow the way somebody would actually use them.
If you think about it, I think, Chris, if you think about the Amazon experience, right? Anybody Amazon shoppers in the room? Yeah, right. I have more boxes in my garage than I care to imagine right now. My wife is a great Amazon shopper. You think about that experience, right? And Amazon knows to present to me exactly what I'm looking for before I even know what I'm looking for. Imagine that kind of experience in government where I know enough about Chris and Darius that I can give Chris, here's some programs that you might be interested in. And then I can give myself programs that I might be eligible for all at one time. And I can give one setting, give them all the information that they'll need to qualify me for every program. I have been looking for this magic bean for a long time, right? Because I told you my age a while ago. I remember when we used to go into one of my offices and we would swivel chair here and do SNAP. And then we go to another machine and go and do Medicaid. Mm-hmm. And then we go to another machine and do WIC. I don't know if anybody's in here old enough to remember that, but we literally had 3 different systems that we had to go into to try to approve the same family.
Right.
It was, I'm still amazed that we got through it.
And one of the real life impacts and implications, again, happened during COVID.
Yeah.
So for those of us who are helping state agencies and communities and counties and states do everything from surveillance to immunizations to MaxVax to notifications to training, we weren't able in our industry to have a holistic view of a person or their community or their family. And as we all found out, a lot of the challenges and people who are impacted were in large family situations. And so part of the design and intent of where we're going with this is to very easily have a whole health view of not only the person, but also the family relationships and access, and making sure that we talked about the data piece earlier, making sure that there's a single source of truth from a records and data perspective. So these were all the things that we said we'd have to address. Let's understand the implications of ServiceNow as we went through it. The theme here is AI. I'll give you a couple examples of where we're using AI in this same respect. States, all of these programs are bound by both state, community, county, and federal regulations. At any given point, none of those entities could tell you whether or the degree to which they are compliant with said regulations. That gets pretty scary. And so we've been working on and have built technology and logic that will, using large language, not only consume unbelievable amounts of data, right, either from the federal, state, or county, and then be able to run a compare and contrast against any one agency's performance in their systems. A simple example, but determining your regulatory compliance in days versus years is pretty significant. And then being able to apply those changes using AI to say, well, what has to change? So it's new, it's fast, it's scary, but it's probably less scary than some of the use cases that I suspect we'll be looking at over the coming years and months. So again, these were the component pieces. This is what we felt needed to be in place for us to move forward. A unified platform, advanced automation capabilities. The idea of using AI agents to move information in and out of the old data migration system or whatever stays behind whether that's a repository of some sort, but allows you to very quickly move back and forth with integrity, was awfully important. More modern interfaces, mobile everything, right? Moving everything to applications that will align with how people operate and live their lives these days. Here's what was really important: low code, no code.
Absolutely.
Getting rid of, hard coded systems and processes where we had individuals actually building, versus a rules engine that can be changed in a matter of hours and be back in production, or run what-if scenarios. So that was a huge part, because state agencies, and I'm sure it's same in federal, are just exhausted from the amount of money M&O costs from a continuous code development perspective. And then I talked about the built-in compliance and security protocols. Don't know if that's us getting cut off. So all of those things are being built into this use case. I don't think it's the only use case. No. I mentioned some of the other areas that we're looking at in our practice at EY is about risk management. At some point when it comes to behavioral health, opioids, homelessness, maternal health, veteran health, we're going to have to start focusing on stopping the bleeding. Not just addressing what's in front of us, but finding out the cause. An example that we've been working on is if a child, believe it or not, if a child suddenly enrolls in a school lunch program, more than 65% of the time, that is an indicator that they may be moving towards a homeless or poverty, or homelessness or a food challenge situation. If we could combine data, if we had these kind of risk profiles and risk tool sets that combine data sources from the agencies instead of them all being in stovepipes, we could create a much better risk profile to enable agencies as they deal with these issues. Yeah. So again, ServiceNow is just, for us, has become a great tool for thinking through and finding ways to move that kind of concept into application.
If you think about some of the announcements that happened today, the data fabric layer, pretty important and amazing to me, right? Because now, like Chris was talking about earlier, being able to identify risk. If someone applied for SNAP TANF benefits, then I'd be able to see, like, okay, they've applied for that. Well, maybe they might need Medicaid because they now qualify for SNAP TANF, or maybe they might need free school lunches. So being able to have integrated data without disrupting your mainframe systems and bringing them over bit by bit is pretty amazing. We got 5 minutes left. Questions? Yes?
What do you think the biggest challenge on that, Chris, both of you creating that federated data set that enables you to get that holistic view, like not only is what does somebody need today, but anticipating what they need in the future? What's the biggest challenge that you've seen in negotiating the fact that the data is not federated? I
think there's a fear of doing so, right? Because all these programs have been so segmented for so many years, and now we're seeing administration changes where we're looking for optimizing and looking for the opportunity to mitigate those kinds of risks. So I think now it's being encouraged, right, to do so. I think with data fabric layer that ServiceNow just introduced AI, it's become a lot easier. Back in the day, again, I'm older, so I remember when it wasn't so easy to do that. But now, with the new tool sets that are being released, I think that'll be a lot easier, and the fear level will subside, knowing that I still have my data where it belongs, but now I can kind of see it as an overlay across all of it.
Just a review that question that previously, can you speak to whether ServiceNow is relevant in isolation, or is it a combination of certain other tools based on the legacy investments that are already there?
Mm-hmm. I think it's and Chris can speak to us from an implementer perspective, but I think for me, it's relevant in both cases, right? It can stand alone and pull in all of the data and the tool sets that you're using now in many cases, not all, but many. And then it works well, it plays well in the sandbox with everyone else, right? So I think that it's not a question of or, it's both and.
Yeah, I would say, and by Jeff, I'd add one more thing, and that's permissioning, right? It's just behavior and collaboration in state agencies. What we're trying to avoid, what doesn't work or is really painful are just wholesale big bang replacement systems. Yeah. And so when we started out thinking about this, that wasn't what we intended to do, right? The first idea was leave what you have and just extract the top 12 activities or functions and build microsystems so that those things will work faster, right? So much more of an iterative approach, which whoever's being taken from is probably not happy because their model's going to change. But it allows for us to be as fast as the technology would allow us to go if you just get out of the way, kind of thing, right? So I think there's always going to be that managing of what's legacy, what's not, where do we put the focus, how do we work together, and then adoption, right? The faster people get comfortable with these things, the more there is to do. We as a vendor and in the space just have to help agencies think about how to balance that. Going fast without overthinking it all, right? What's that? And we're helped by the fact that agencies are bringing on more and more people like yourselves who have technology backgrounds, right? Who've done this in other industries. So that's a long answer to a short question, but I would say it's got to continue both for some period of time. Oh, yeah.
How do we get to this point where we have 40-year-old systems that get depth? Why did they not overhaul earlier?
Good question.
Yeah, they're expensive. Yeah, the answer really needs bourbon, but it's painful. A lot of the people who built them are no longer there, so the folks running them don't know how it got to the point it is. And there's so many other things to deal with that it was just easier. I will also say that CMS has allowed vendors to protest stuff, right? You'd be surprised that I would say 90% of the older systems, those states have re-procured a replacement system 2 or 3 times and it didn't go anywhere because of protests. It's nonsense. Stop that and you'll move faster.
Yeah.
So, somebody else.
Yep.
Yes, Chris, you mentioned earlier that enterprise systems were monolithic, like large.
Yep. Yep.
Implementations of vendors. CMS has been encouraging more modular implementation in the last 7 years. What is that ServiceNow similar system that can benefit? Like what specific modular and maybe taking an example of what was done in Arizona.
Yeah.
Because it's not meant to replace the whole thing.
Correct.
So what are the areas that you see the focus with?
Yeah. I mean, by design, even the monolithic system is a bunch of different functions, right? Claims, financial, reporting, enterprise data, content, all those things. So things like reporting, Mars and Sewers reporting, it's a no-brainer, right? That should all be done in an automated way using a tool like this. The financial reporting, back as a fiscal agent, back and forth to the federal government, no-brainer, right? Should be a standalone module. What it shouldn't be like it's really painful to build a claims engine. I don't think that most states want to get in the middle of that, right? But if you deal with all the other ancillary pieces, I think then you can bring it forth. CMS started by forcing states to replace everything, which they realized quickly is not smart, right? Determine what's legacy, how are you going to support it and with whom, and then what are the pieces where it makes most sense. There are some platforms that work. I think we're going to see over the next year ServiceNow just accelerate to the top. And that, I'm not a paid spokesman, unfortunately, but I just think as somebody that's could quickly exhaust his technical acumen, it just makes sense, right? It's just designed the right way. And then when I ask that question, all the smart people say yes. So I feel better about it.
Thank you.
Yes, ma'am.
Thanks.
So, tech care.
Yeah.
Yes.
Tech care is ineffective blockage. So just having people pay attention to what's happening in the news, what's happening with Medicaid, and how you can operationalize that and turn it into your technology, BD roadmap. You said it took you guys 10 years to kind of get to where you need to be.
Yes.
Talk a little bit about how ServiceNow, like if there were to be this national change in Medicaid and everybody started focusing on block grants, like what's the technology roadmap and how does ServiceNow help other states get to a block grant based on?
I'm glad you asked that, and I know that we are at time, so I'm going to answer really, really quickly. Being able to simplify implementation, not just from a technology standpoint, but from a programmatic standpoint. So being able to take and ingest the rule set from CMS and the guidance, and being able to quickly ingest that into a platform using AI and the tools that are available, and being able to almost write the code itself at this point, and quickly get that up to speed so you can test it and make sure that and fix the parts that fail. And I think that's fail forward more quickly. I think that's the beauty of the platform, is that it allows you to do that. And the fact that the platform twice a year gets updates. So if it didn't have it like 2 years ago, you can bet your life that it's going to be on the platform in about a year. So I think that those are the two different opportunities very quickly, but we'll talk afterwards and I can tell you more.
Yeah, and we have one of our grants experts sitting that first row right there.
All right.
Grants technology is pretty well advanced. The other thing is you don't have to start from scratch. There are commercial agents or commercial markets that are doing this already now today, that if there was better collaboration and communication, could be moved into government and just dealt with, what is different, which is less than most people think. Really appreciate the time and the questions. Wish we had more, but thank you very much.